21, I was attacked by somebody I was in a relationship with. So I had an acute trauma, and because of that acute trauma and then getting COVID, I was experiencing suicidal and homicidal thoughts, which was a new thing for me. And I sought the help of a psychiatrist that recommended ketamine therapy. And I found myself at the Ketamine Clinic of Los Angeles. The first session I had for therapeutic ketamine, I immediately, upon the nurse asking me how I was doing, said, "I think I'm here to recover myself that I lost." I would say that if you are experiencing any kind of mental health challenge, ketamine therapy could be pivotal in the break of negative thinking that's keeping you in a loop. It was for me, and it's not anything to be scared of. Did I trip balls legally? Yes, I did. Was it helpful? Incredibly helpful. The results were immediate for me. I could tell that the negative pattern, the loop that I was in my thinking was broken immediately. And so much so that I was supposed to have 6 sessions and only really needed 5. And when the nurse asked me why I wasn't coming back for my 6th session, I said, because I got everything that I needed from ketamine therapy in my acute condition. And she said, wow, the therapy really worked for you because you probably wouldn't have advocated for yourself 5 sessions prior. Therapeutic ketamine infusions helped me to break suicidal and homicidal thinking after an acute attack. I had a trauma that was profound. I don't think that I would have been able to recover from the trauma as quickly if I hadn't experienced therapeutic ketamine at Ketamine Clinic of Los Angeles. After the infusion, I wasn't allowed to drive my car, so I had to have an Uber bring me home. And for the rest of the day, I was out of sorts. I wasn't able to function and work. My body definitely needed time to recover. I wouldn't have been able to have a reasonable, decisive conversation with anybody the day of the treatment, but certainly waking up the next morning, I felt normal. I wasn't afraid of becoming a ketamine addict from receiving therapeutic ketamine. I was definitely educated before the session that wouldn't happen, that it wasn't an addictive type of substance. And I didn't feel like I needed ketamine again after the 5 infusions that I had for my acute condition. It was never a concern for me that I would become addicted, and I didn't feel like it would be something that I'd want to get addicted to. It wasn't 100% pleasant for me, even though I did trip balls in the 45 minutes of the experience. It wasn't something that I really wanted to experience again. It felt like something that I needed to do to get through my acute stage, but it wasn't something that I would go and seek out for a party type experience. Big shout out to Denise, my girl. I love the staff at Ketamine Clinic of Los Angeles. Not only were they incredibly supportive, but they treated me like a real human, and I felt so at home that I obviously came back even though I'm not getting treatment, because they're just such stellar human beings. I can't recommend the clinic and the staff enough. If you're looking for ketamine, therapeutic ketamine, I highly suggest this is the clinic that you come to. They're family.
Hi, my name is Sam Mandel. I'm the co-founder and CEO of Ketamine Clinics Los Angeles, and we were one of the first ketamine clinics to open in the United States in 2014. Recreational ketamine use is illegal. It typically includes 10 to 20 times the dose ranges that we use in the clinic for therapeutic indications. Typically, people are snorting it in powder form when they're using it recreationally. We utilize IV infusions. That's the gold standard. It's the safest and most effective way to provide this medicine therapeutically. So there's differences in the route of administration. There's differences in the legality. Also, we monitor vital signs for safety. So pulse, oxygen, saturation, EKG, blood pressure, all hospital-grade monitoring equipment to make sure that people are comfortable and safe during the infusion. And we have licensed medical professionals who are also monitoring to keep people comfortable and safe. Recreationally, of course, you don't have any of that. that as well. Also, usually drugs on the street are cut with other substances. They're adulterated. And fentanyl is increasingly common, the opioid. Very, very dangerous drug. Very, very deadly. Very small doses can be fatal. So you really never know what you're getting. There's also a lot of designer drugs, copycat drugs that are supposed to mimic the effects of ketamine but aren't, and they have much worse side effects. So you don't even know that you're doing ketamine when you're using it illicitly, or surely probably not pure ketamine. Obviously in the clinic we get pharmaceutical grade medicine, legitimately through distributors. So you're getting actual ketamine and nothing else other than ketamine. So those are some of the key differences. Overall, clinical ketamine is much safer, much more therapeutic. I would argue that the street use or illicit use of ketamine isn't really therapeutic at all. And it can be dangerous, of course, depending on the situation that you're in, your environment, where you are, who you're with. Your mindset and setting is critical in terms of being a therapeutic effect of taking this medicine or having what could be a weird, strange, difficult, or bad outcome. There's a whole complex system of neurochemical effects that are going on in the brain when you receive ketamine therapeutically. It's an NMDA receptor antagonist, that's N-methyl-D-aspartate receptor, so it causes an increase in a neurotransmitter glutamate. A reduction of glutamate or lower levels of glutamate are associated with challenges with mood, with sleep, with appetite. So this helps to promote those behaviors and just feelings of well-being. Glutamate is actually the most abundant neurotransmitter in the brain. And it also helps to create new neural pathways to form, neuroplasticity. Dendrite density and connectivity is enhanced through therapeutic use of ketamine, particularly in the IV infusion route of administration. So there's a whole bunch of processes that are occurring. It's also an AMPA receptor stimulator. So we're still studying the brain and trying to understand fully how exactly ketamine affects it, but this much we know, and we know that there's actually measurable improvement in brain activity and in brain function when somebody is receiving ketamine therapeutically. It's actually measurable, and there's even physical growth in parts of the brain like in the prefrontal cortex. So this is a really profound treatment in comparison to what we've had today, primarily SSRIs and other oral antidepressant medications that are often just addressing symptoms and not the root causes of issues. Ketamine really has a whole bunch of processes that occur in the brain that can be very, very healing and therapeutic for long-term benefit, in addition to the experiential component of what's going on during the medicine session. The journey, if you will, that people go on can be very, very profound. Ketamine is kind of like a reset for the brain. People talk about it being like a reboot or a reset, and it really is. It kind of like gives you a clean slate. It really does help to form new pathways in the brain, new ways of thinking, new ways of being. It can really disrupt patterns. Of course, you need to do the work to be able to lay down that positive habit and routine over that, but it's a fresh slate. It's a new opportunity. People often feel a sense of just hope and healing and joy and enthusiasm, motivation to do the things that maybe they knew they needed to be doing, but they were struggling with. They didn't have the energy or the ability to do, such as eating healthy, sleeping better, exercising, engaging in talk therapy, rekindling relationships with family or friends, or establishing new ones, and all these things. They just start to happen more in this period immediately during and after treatment, when the negative symptoms start to get quieted, and then there's room, there's space to fill that with more positive ways of thinking and being. First of all, I would say that usually thoughts of self-harm or wanting to hurt oneself or others are the very first to dissipate when people have ketamine, which is amazing. Even before their symptoms of depression or anxiety or PTSD might fully abate, those negative thoughts of self-harm go away first. And that is so critical and so important. I personally believe that ketamine should be given to most people who go into the ER or present in an emergency situation due to thoughts of self-harm and suicide. And we've had patients who have literally come to the clinic instead of going to the ER when they needed to make that decision. Either I'm going to come to you now, can you fit me in today, or I'm going to have to go and check myself in. And we've seen time and time again how powerful this medicine can be for that. As far as your question, typically people need boosters or maintenance treatment. It's not a cure, it's a treatment. They need to also participate in their own wellness. And some people need to come back every month or two, others come back every 6 months or 12 months even. We had some patients go for over 2 years after their initial series of treatment where they didn't need any additional care until they came back and saw us about 2 years later. But that's not typical. Typically we're seeing around 3 months. And people get a pair of boosters, not another whole series of 6 infusions. So it's just 2 infusions. That usually extends the benefit. And over time people generally come back less often, not more. So they're able to get more mileage in between their follow-up sessions. And that's what we like to see. We want people to be less and less reliant on this, and it's available whenever they need it. People who have really severe suicidality definitely probably going to need more follow-up, more regularly, and also more supportive wraparound care. I would say we've had great results with bipolar depression. Ketamine is not going to be something to treat the bipolar itself as far as a stabilizer, but it can help with the depressive aspects of that. We do need people to be in a more stable state when they come in for treatment. If they're hypomanic or manic, it's not a good time for them to be treated. As far as personality disorders like BPD, those are not typically positively affected by ketamine. Again, if those types of people are dealing with depression or PTSD or other challenges, the ketamine can absolutely help with some of those issues. However, it isn't a characterologic treatment. It doesn't address character issues. It doesn't address personality disorders. So again, that kind of thing really does require more intensive therapy and treatment through things like CBT, DBT, and other modalities. I don't want to say ketamine's like a one-size-fits-all, but more and more research is coming out about not only ketamine but other psychedelic medicines, and how it's kind of strange sometimes to people that these medicines are beneficial for such a wide variety of conditions and diagnoses. And I think we're starting to come around to understanding that these different conditions are really not so unique. They're not such unique states. They're actually more symptoms of the same condition, same issue, just manifesting with different symptoms. Typically, it roots back to trauma in one way or another. And why does one molecule in the same dose and in the same protocol help depression, PTSD, suicidality, anxiety, OCD, postpartum depression, substance use disorder, disordered eating, and other mental health conditions as well? How is that even possible? It kind of turns conventional DSM and other psychiatric understandings on their head. And I think it's as we talked about earlier, it's the effects that are going on in the brain that are really unique to ketamine in terms of increased brain function, new neuroplasticity, the ability to form new ways of being and thinking that is really profound. And it's also the experiential component, the journey that people go on, and the deep inner work that they can accomplish during those medicine sessions. That combination is really, really powerful, and it's helping people to heal from a wide variety of conditions, including substance use disorders. And ketamine gets at those underlying issues that are often causing people to use substances. Most people who are abusing a substance are doing it because they're dealing with depression or PTSD or anxiety, and they're using alcohol or drugs or whatever it might be to cope. And ketamine helps to alleviate that suffering so they don't feel a need to rely on those things as much, to numb, to avoid, to deal with. And it also can help to curb cravings. And that's another interesting aspect of ketamine in terms of if people have some sobriety and they're working on it and they're working through therapy and through a program, it just helps them with any kinds of cravings. So it's really, really good treatment for that. A lot of people have a hard time wrapping their head around that because they say, oh, don't people misuse and abuse ketamine? How could it possibly be something that helps for drug abuse? Well, it does. And if someone has a problem with ketamine, probably not a good treatment for them. But any other substance under the right circumstances in a controlled therapeutic clinical environment administered by medical professionals, it can be very healing. Obviously, if you give someone who's an addict a bag of ketamine and say, here, this will help you out, that's not going to go over very well. So we're talking about the clinical and safe therapeutic use of ketamine. It's only legally available as a medical treatment by licensed medical professionals in an office, in an appropriate setting. So it's not legal for anyone to possess it or use it, buy it or sell it under any circumstances otherwise. It's a Schedule III controlled substance, and it is regulated, federally legal. It's FDA approved. I mean, ketamine was synthesized in the 60s. It was FDA approved in 1970. It's been around for over 50 years. It's been among the most widely used anesthetic in the world. Very safe, very effective, tons and tons of studies, research, and data on the safety and efficacy of ketamine. There's at least 200 clinical trials about ketamine specifically for mental health alone, not to mention all the research that was done to get it approved as an anesthetic, which is what it's approved for. So very safe, very, very effective. It's a very well understood drug because it's been around for such a long time. So yes, it's federally legal in all states. Well, I wouldn't say that. I mean, there's special interests who, would love to see it go away as a treatment, and people who are actively trying to regulate it more and control it and minimize its access in all kinds of ways, because ketamine is a threat to the status quo. Ketamine is a more effective treatment that costs less money, that no one player in the pharmaceutical world can make much money on, because it's an inexpensive generic drug that's been around for so long. The patent is up. So those who make drugs want you to buy their name brand, high margin drugs instead. Those are the drugs you see on TV. Those are the drugs that the doctors hear about when they get taken to nice dinners and told, hey, you should help your patients with drug X, Y, or Z. And that's what makes healthcare in the United States and the Western world go around. So when you have this cheap generic drug that is manufactured by half a dozen different people in the US that is readily available at low margin, and anyone can get it pretty much anywhere, from a doctor, throughout the country, they don't really like that very much. It also just works a lot better. People come in, they have 6 infusions in 2 weeks, and then they may not need treatment for months. That's not a good model for pharma. They don't like that. The model is, let's get you taking a pill every single day for the rest of your life until you die, and let's make sure that pill never cures you, but never kills you either. That's perfect. You can be a customer for life. That's what their model is. This is totally not in alignment with that, and they can't get paid on it, so they don't like it. Some are starting to cover it. Blue Cross Blue Shield of Massachusetts, Kaiser SoCal is covering it for some members. We have a contract with them for members of Kaiser SoCal specifically to get treated with us. It's always up to the psychiatrist at Kaiser. That's not up to us to determine. They make the referral though, and it's becoming more common. There are also certain organizations that are working on being kind of the middleman between the self-funded, self-insured large employers and clinics like ours to be able to facilitate access to this treatment. Yes, so we prescribe ketamine lozenges or troches to some patients to help to extend the benefits of their treatment if they have a really good result that's short-lived. We don't typically like to put people on them. They come with some potential, issues as far as a safety standpoint. So it's very selective for us. There are companies out there that are offering troches, lozenges, nasal sprays for people to take at home unsupervised without any sort of real assessment of them. We really don't support that. It's not as effective. It's not as safe. No one gets any at-home ketamine from us unless they've had a full series of treatment with us. We know who they are, how they respond to the medicine, what their optimum dose is. We get to know them. We can ensure that they'll be compliant with their prescription. They're not going to misuse it. These are all really important things when it comes to at-home ketamine. It's definitely much riskier. It's not for everyone. For those who are a good fit for it, it can be really, really beneficial for them. I would say almost any condition that is a good fit for in the clinic ketamine. So, depression, PTSD, anxiety, suicidal thinking, those are all conditions that can benefit from at-home ketamine. The thing is, typically the medicine being taken sublingually as a troche or lozenge at home isn't sufficient enough to bring people out of the depths of their despair on its own. It's really good for maintaining a good benefit that's achieved through IV infusions. If somebody's really in a bad place and they think they can just start on the lozenges, it's not typically going to go over that great. Now, obviously, there are people out there, getting prescriptions online from other companies who aren't as severe in their challenges. We see a lot of moderate to severe depression, PTSD, a lot more complex cases. And in those cases, they're not enough on their own, the troches. They are good at extending the benefits of the infusions. But most patients at KCLA are able to come back for boosters as needed, and that helps to maintain the benefit really well. Yeah, I think for the right person, absolutely. I think the troches could help. It really is very individualized though. It's really on a case-by-case basis. That's something that our clinical team determines based on each individual, their history, their time in the clinic with us. So high level, sure, if someone with PTSD or CPTSD absolutely could benefit from troches or lozenges at home. It's really going to be super case dependent though.